and good evening. I'm Tony Yuzhou, the CEO of IACAET. So together with my colleagues from IACAET, we would like to welcome all of you to join this global event, today's book launch for Down therapy with some distinguished authors and colleagues in this field. It's very exciting to see there are so many colleagues signing from all over the world. I counted from over 50 countries and regions. And so it's very exciting. And thank you for each of you for being with us today. In this very challenging time of pandemic, we as human beings are longing to reach each other. The internet technology enables us to get connected, but without the embodiment experience, this connection is limited. The dance and art, through its creative flow and energy, help us to further enhance this connection. When we become part of dance, we become part of nature, and our connection become authentic and far-reaching. So enjoying the dance and connection with other human beings in our daily life. It is our great pleasure to present this event to you to support the development of our global community, diversity, dialogues, and collaboration across regions and disciplines, which is synchronized with the mission and the vision of IACAET. So before I pass on to our host, may I ask you to mute yourself, except our speaker, of course. And you can always switch between the gallery view and the speaker view by clicking on the top right button of your screen. We also like to inform you that today's webinar is recorded for archive and educational use in the future. If you don't feel comfortable with that, please switch off your video camera or sign off from this live session. So now let us welcome Masha Plevin and Zeynep Katay, our two hosts today, and other authors to the front. Masha and Zeynep, the floor is yours.
Take it away, Zeynep.
Thank you so much, Tony, and thank you for creating this platform, and thank you Lama Majaj and Yi Chen for their amazing help in the organizing. It really expands my heart to be in the presence of so many wonderful people today. It is an honor to be part of this book. It brings together such an amazing collection of papers with 26 contributors, and it's truly an honor to be one of them. And it's really an honor also to be in the presence of so many important contributors to this field of dance therapy today. We really have some pioneers and a whole new generation, as well as really important educators, authors, practitioners, and researchers in the field. And with this book, Hilda Van Grover and Sharon Chaklin really did such a valuable task of bringing together an amazing selection from all around the world. So it's truly a global coming together, and it is a global book. So I'm hoping today we'll have just a glimpse of all of that's in the book. So how this event will flow is we will have Masha Plevin lead us through a movement sequence in a little bit, just to start by getting into our bodies. And then I will turn it over to Hilda and Sharon to talk about this book. And then we will have three different discussants presenting on the three sections of this book, focusing on dance, research, and practice. And throughout the event, we do encourage you to use the chat box. It has been used so wonderfully, just to say hello, just to mark your location on the globe. but to save the questions to the very end. So at the very end of this event, we will have a question and answer section, and we will highlight questions, pick questions from the chat box at that point. And you could pose them to the discussants, to the authors. Now, of the 26 contributors, I believe a good number of them are here in attendance in the call, but not all of them. So it might be possible to pose questions to the authors themselves, or it may not. We will try and see. But really to try and keep the questions to the very end, and hope to have a wonderful session. Thank you all for attending, and I will pass it on to Marcia.
Hello all. Thank you, Zeynep, for that introduction. I feel so honored and acknowledged that I'm asked to give a movement experience to my colleagues and cohorts who are dance therapists, but some of you may not be dance therapists. So this experience will be a little bit more directive than usual, because I don't know how many or who are out there. And I'd like to just speak a little bit about my lineage. My lineage is a Western lineage. I'm American. I did my training in Italy, but the lineage is from those pioneers. Yet in front of us, we have people from other cultures that have other cultural lineages that bring them to dance therapy. And I want to honor that we have these different cultural dance therapy lineages here with us today. I'd like us to begin by each one of us, you look so set in your rectangles that I'd like you to simply just let your body just move out and kind of like try to touch without seeing, but you see those lines that make that rectangle that you're there. Just give yourself a nice stretch, an inner outer breath stretch. Kind of begin moving the upper body, because most of us are sitting down, but kind of move the upper body. And as you do that, take a nice in and out. So I'd like to give you a few moments. There's some people that are standing up, and that's fine. Sitting down, standing up. How wide and big can your breath be in the space that you're in? So I'm going to stand up a little bit to give myself more space. Kind of like let myself feel the space around me. You can do this sitting down, you can do this standing up. Or you can just feel your space around you. Now, as you feel the space around you, I invite you to feel where you're supported. Are you supported on your seat? Are you supported under your feet? Kind of let your feet or your seat move with your breathing. So the whole body and the spine begins to breathe. Just allow that just to happen. You don't have to look at me. Obviously, this is dance therapy, so you do what you want. Everything is right. And then I ask you to find some place that wants to do a little shaking. For me, it's my arms and my knees. Allow some shaking into your body in any way you want. We're getting ready to open space to receive. We're getting ready to open space to receive. So I invite you to put your hands on your head, around where that brain is, and allow yourself to feel the top of you. Feel your forehead, feel your head. Feel the bottoms under your feet. Now the space that you were feeling before, let that become a dance that you breathe with or you shake with. It could be breathing and shaking. So I invite you to feel that impulse. What impulse do you have right now to either breathe or shake? Could be breathing and shaking both. So I invite you to find your rhythm. What is a rhythm for you? For me, it's like this, a little jazzy. Do-do, do, do-do, 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 do-do. So find your rhythm. Get your feet going, rhythm. Get your knees going, rhythm. And get your breath. And find your way to your breathing again. Feeling what may be going on in the body through the body. And bringing your hands to your eyes and your face. Letting yourself slow down. And I'm going to invite you to go inside your mind and your brain. Your eyes can be closed. I'm going to invite you to feel space inside your mind. And let that space that you feel have an expression in your arms, in your hands. Space to receive. How do you open your space to receive in your mind? And your being here is also a giving. So I invite you to feel the gesture of receiving with your own giving. Your being here, your presence is a gift. So between receiving and giving. Each one of us has given in some way to dance therapy. Tonight we're going to receive, but I want to honor that you have given. So in this moment of your own improvisation, of your own giving and receiving, I have found a gesture, a movement that I like. So I'm going to repeat it for myself. So kind of feel what that feels like. And I'm going to ask us to now sit down at the screen and looking at each other, just repeating that gesture. And those with the screens open, I'm going to invite you to do something dance therapists love to do, which is mirror. So I'm going to take a movement that I see and I'm going to mirror. I'm going to give. And I'm also going to receive. We don't know, we can move from one giver to one receiver in ways, and we can change our screens, going to another screen, taking the movement from the other and giving our own movements. It's seeing and being seen. It's in both giving and receiving. And we also play. It's part of dance therapy is playing. Yeah. Who knows whether we can get a communal gesture here going. Let's go. Let's try. Let's try. Let's try. Get the sound. Get the movement. Yeah, I feel it. I feel the dance. Yeah, I do. I do. I do. I do. I do. I do. And to this beat and rhythm, I'm going to say thank you, thank you, thank you, thank you. Thank you, thank you, thank you, thank you. You've been wonderful. You are wonderful wherever you are, whatever culture you're in. A little glimpse of movement and dance. And I hand you to Hilda, the next phase of our evening.
Okay. Thank you, Marsha. It was great. Really great to begin in this way. Just a moment. Okay, so we began this evening. For me, it's an evening. I don't know how it's for others. So, but you know, it's for me, it's really a book launching is always an opportunity to rejoice, like the launching of a rocket to space or a boat into waters. Sharon and I, together with all the marvelous authors, we are able to send off a book about which we have deep interest and much passion, in which there was an investment of much time and work. And also, as I said, a collaborative effort with authors from many parts of the world. And today, thanks to communication technology, we are able to celebrate with an audience that too is gathering from many points on the map. And many of us, maybe all of us, share the enthusiasm for our profession and our love for dance. This is very heartening. Some of those present have already begun to read the book, while others are gazing into the window of their computer screen in order to learn about this new book. We also have present here some of the authors and the discussants. And I want to say thanks a lot to Tony Zhu and all the people that work with him, especially Lama Majaj and Ji Chen, and also to Zeynep Chatay and Marcia Plevin that were the originators of the idea for this event. Thank you. And now a little bit of history. When our publisher invited Sharon and me to put together a third edition of the book, The Art and Science of Dance and Movement Therapy, we both quickly agreed between us that we prefer to work on a completely new book. Immediately, we were drawn to focus on dance and creativity within dance movement therapy, as we were concerned that dance has been minimalized within the discussions and practices in dance therapy, that we were losing our foundation and roots based in this fundamental art was of great concern for us. We both consider dance as an art form basic to the core of what it is we do professionally and who we are. There seemed to be an increased use of verbalization or other ways of handling clinical processes and situations, likely due to studies in psychotherapy that many of us in our community were and are undertaking. These studies blessed our profession with more sophisticated knowledge of psychic processes, of group process, and more. However, the therapeutic potential of dance and creativity seemed to have gotten lost, blurred or misunderstood in that new learning, perhaps to the lack of more systematic study, and thus mystifying a little bit dance. When speaking of dance, we include the creative process and the concept of aesthetics in its broadest meanings. Some of them are connected to creative perception, vitality, and positivity as possible ways of being. We consider there is a difference between creative process and dance. In therapy, the creative process develops in the transitional space of the therapeutic relationship and in the patients exploring and performing the dance for themselves and maybe also for the therapist as witness and container. As Catalonian philosopher Ferrater Mora wrote, to create is to make something beginning from some already existing reality, to transform something possible into actual, into a new existing. Now I pass the microphone to Sharon. Sharon, are you there?
I don't need to unmute.
Right.
Got it.
She's
Got
on
it.
mute.
I was, but now I'm back. So hi, everybody. As demonstrated in research, dance can be felt as enhancing the experience of authenticity and vitality, or as a door to discover and try unknown aspects of oneself. Unfortunately, dance can also be taught or used in ways that constrict a person and alienate them from themselves. We can witness an individual trying to please the other, including the therapist, of moving disconnected from oneself while trying to conform, or being unable to explore or dare to be open to new possibilities of being and moving. There's no creativity within that dance. Nevertheless, as stated by a participant in a research study, dance is felt as an opportunity, quote, to feel and revive the linkages between me and me being in this moment, and an authentic encounter with history and the present, unquote. This book emerges in the context of what Rosemary Zamarita called the aesthetic turn in the arts therapies and its diverse connections with psychic life. By so naming it, it is likely a counterpoint to what we have been discussing before regarding the weakening presence of dance in therapy. However, over the past 7 years, we have been seeing a slow but steady interest in the unique factors of dance movement therapy materialize within research and writing. Most of these specific healing factors stem from our roots in the art of dance and the lived experience of dancing in a therapeutic context. While the book is divided into 3 sections about dance, research, and practice, there's often an overlap of these central topics. For instance, the book presents research about a specific intervention or taxonomies about creative processing in the practice of DMT, and aesthetics being a central aspect of the therapist planning her work with persons of dementia. As editors, we were interested in how universal these concepts might be. We therefore sought practitioners from several countries to find out how pertinent dance and creativity are to their practice. And colleagues and philosophers submitted drafts of what they were interested in writing about connected to these topics. The proposals chosen were appealing from both research and theory, as well as issues of practice. It was exciting for us to be in contact with individuals holding different perspectives of dance movement therapy related to their cultural, ideological, and theoretical backgrounds. Body movement and dance were the prime subject of their work. It was gratifying to learn while there were differences related to cultural and theoretical backgrounds, there were many commonalities. However, it is also the differences that provide possibly new perspectives that might offer interesting ways of thinking about one's own ideas regarding dance therapy. We hope the readers of this book find it of interest to delve into dance therapy practices in different parts of the world, which might be both familiar and also have interesting distinctions. We want to express our gratitude and admiration to each author that collaborated to make this book possible. Our discussants will speak about the dance, research, and practice sections of the book. Before each of them begins, there will be a presentation of the titles of the chapters and their authors within the section that will be discussed. We will begin with the section related to dance. We are honored to have Dr. Miriam Roskenberger as our discussant. Mimi has long been active in the ADTA, presenting international panels and at the conference focused on many subjects. However, today her focus will be dance itself. So thank you and welcome, Mimi.
Oh, thank you.
First, Mimi, we're going to show the authors of the chapters you're discussing.
Let me share my screen. Do that.
Okay, Mimi.
Okay, thank you very much. Thank you. I first want to thank Sharon and Hilda for editing this spectacular book that covers issue in dance therapy that have been utmost importance to me since I first began in the field 60 years ago, and for inviting me to be part of this. Core elements of dance and the creative process itself as basic to dance's therapy have always been primary to me. And my teaching of dance therapy methods has focused on the creative process as the core process to be used in dance therapy. And of course, the international aspect of the book is very important to me, as Sharon mentioned. So as I read and as I read the first section of the book, it was fascinating to see how concepts that have always been primary for me were framed a bit differently by different authors. I do want to tell you now that my original intent was to carefully summarize each chapter for you. But then I began to see that it might be better if I roughly summarized and then focused on a particular point that caught my attention. So in the important first chapter, dance comes to the front stage. Hilda illuminates the specific aspects of dance that hold its intrinsic potential for therapy, both for healthy development and for positive change. It's a very complex presentation and touches on many levels of both phenomenological philosophy and psychoanalytic theories. She talks about the realization by early modern dancers and dance educators that dance itself offered a means towards self-knowledge. They and their students were developing beyond their technical, choreographic, and intellectual achievements. They understood the power and use of dance throughout human history to transform and to heal. And Hilda speaks of her own process, which I think we all experienced, of becoming aware of the power of dance as therapy because she was aware of the impact of dance on herself and her students. I think what struck me as most important in this chapter is the discussion based somewhat on the ideas of Suzanne Langer of dance as a virtual realm of power and of dance as the channel of forms of feeling. A virtual realm of power refers to what dance therapy calls the exchange of energy through kinesthetic empathy. And forms of feeling refers to the capacity of dance to contain the range of our felt experience, sensations, emotions, all of our subjective experiences. Dance expresses experience that are difficult to analyze because they may be ambiguous or complex, and because they have multiple levels of meaning, because words are not enough to describe the intensity of the experience. Emotional life is complex and fluid. Dance is suitable to approach this complexity and to form this feeling. Langer says, in dance, there is a display of the way feelings, emotions, and all other subjective experiences come and go, in the intricate synthesis that gives our inner life personal identity and unity. Hilda perfectly states that in dance therapy, we associate the nameless components of such experience in various ways. One way being in a pre-symbolic developmental stage or to an early trauma that continues its impact. In the part of this chapter on aesthetics, Hilda points to aesthetics as a branch of philosophy that deals with the arts, and also to aesthetics as an evaluation of beauty in a piece of art or in nature. And of course, to the meaning of aesthetic as its Greek roots states as knowing through the senses. Hilda expands the meaning of aesthetics that are crucial to dance therapy, encompassing the ideas of Sabine Koch, who formed a model of embodied aesthetics in the arts therapies. And this expanded model includes aesthetics and perception and knowledge. A key point here is that dance and therapy gives us the chance to guide our clients through the possibility of new ways of being, to exploring new ways of moving in a path of self-creation. She also talks about aesthetics and creative living, aesthetics and emotion, and the aesthetic moment, a moment of deep connection, of existential memory, lived as an experience of being. The aesthetic is a guiding concept that creates an imprinted pattern and eventually creates a need in us to fulfill the dimensions of that pattern. The aesthetic experience is grounded in human beings' need to identify with the structural components of harmony and nature. And the Greek concept is that reason, the logos, is nature steering all things from within. Man is not outside nature, but within it. And the aesthetic imperative is the link between intuition and rationality, and the primary channel back to the universal consciousness. The urge of human beings to form, to create patterns mirroring their existence, stems both from the emotional and biological need for harmony and from the rational need for the imposition of order on existence. Hilda includes a survey of her students that extracts the elements in dance that they saw as crucial. These elements were authenticity, vitality and positivity, embodiment, healing, freedom, self-awareness, and expression. The positivity seen in dance resonates with the realization in psychoanalytic practice of the importance of working with the healthy aspects of the clients. Oh, take a breath. One of the most interesting points in the chapter is at the very beginning, where Hilda talks about the use of the concept of dance itself as a metaphor for vital issues or processes. Nietzsche saw dance as a symbol of living creatively, contemplating the harshness of life and death and overcoming all through dance. The essence of dance, Hilda says, is the balance between the basic forces of the body and the spiritual powers in constant fluidity, life itself. Now, chapter 2 is called Back to Basics, and it's by Rainbow Ho, who examines the attributes that heal in dance as therapy. And this chapter is indeed Back to Basics, a terrific title, and covers a topic that is incredibly important to dance therapy. Principles and sources in all dance forms that are the roots of dance therapy. I feel it's crucial to include the study of specific dance forms in any dance therapy education to help our students extrapolate for themselves the principles of dance therapy that can be found in every dance. Rainbow provides a cohesive summary of the evolution of dance in the following regions: Africa, Europe, North America, South America, Asia, Australia, and New Zealand. And she then extrapolates from this vast treasure of dance the three main healing attributes that she sees as uppermost and that occur across cultures and throughout history. These attributes are the aesthetic aspect that satisfies senses and perception, poetic movement that enables expression of feeling, and the contemplative process that allows for transcendent experience. Rainbow says that in several studies, the aesthetic aspects verify the experience of dance as a pleasurable experience related to balance and harmony and nonverbal symbolism, and not dependent on function or meaning. Then she talks about poetic movement that enables expression. And we all know that dance can express meanings and ideas in a symbolic and metaphoric way so that we can recall, reenact, and re-experience previous experiences. And movement symbolism can be individual, and it can also be archetypical, so it may be understood regardless of cultural content. The final attribute is the contemplative process of moving that allows for transcendent experience. This is usually a quiet and calm practice, but Rainbow's use of this term encompasses a wider range. She begins with a quote from Isadora Duncan. Dance is the movement of the universe, concentrated in an individual. In all contemplative practice, the training aims at a relaxed state. to be in the present moment. This state of mind, however, can also be achieved while moving and through movement. In dance therapy, contemplative experience is cardinally important, as the movement becomes the embodied expression of the mind. I have always believed that the core power of dance therapy lies in one of the most powerful human experiences, when the real and the symbolic come together simultaneously. Joseph Campbell believed that this was the core of all ritual. And in thinking about Rainbow's formulation of the three main attributes, I might say that the first two, the aesthetic and the poetic, experienced together would result in the experience of the third, contemplative, when the real experience of body sensation is fused with symbolic meaning, resulting in a transcendent experience. This experience is the ultimate goal of many spiritual dance forms. Rainbow cites authentic movement as a form of contemplative practice. And the third chapter in this first section on dance is Rona Cohn's philosophical investigation of the possibility of authentic movement. Since the rise of social constructionism, the psychological theory of authenticity has been debated. So Rona Cohn offers an introduction to the core concepts of Heidegger and connects them to authentic movement and to dance therapy in an encompassing discussion of authenticity. I'm not going to go into the details about the intricacy of Heidegger's philosophy, but just to note that he said that human beings are the only beings for whom the question of being is an issue, and also that individuality is not a given for humans. Though all humans have a potentiality for being individuals, in our everyday existence, this potential is often concealed or abandoned. And Heidegger says that the fundamental tendency of human beings is to turn away from ourselves, a form of inauthenticity, and to measure ourselves but what the other is or the other has. The question then is, excuse me, is there a movement that belongs to each one of us existentially, that belongs to me as I am, that is prior to my movement as I am a professor of philosophy or I am a professor of dance therapy? What I found very interesting in this chapter was the author's personal experience with Gaga, a movement language developed by the Israeli choreographer Ohad Naharin. She found she was being asked to shed her usual movement repertoire, movements that were professionally and socially appropriate, and to find movements of her own, inventing or locating movements in her own body instead of borrowing them from a known repertoire. Authentic movement is not a response to forces acting upon the body, and also not about the outcome of conscious will. It is movement induced by the unconscious, transcending the dualism of mind and body. Cohn concludes that philosophy and dance therapy come close in acknowledging that movement is a medium of authenticity, not contextualized in the domain of art or beautiful movement. But even if we did contextualize the claim in this way, this would be consistent with Heidegger's thought that authentic movement is akin to a work of art, insofar as both are events of the unconcealment of being. Now, the last chapter in this section on dance is Ruth Ronan's, titled The Invisible of the Dancing Body. And this chapter influenced influenced by
Mimi,
French perspectives.
Mimi,
Yes.
sorry, you have 2 minutes.
Okay.
Okay.
All right. Well, I'm just going to say that this, I wanted to say something about Sandra Fraley's forward. The last chapter by Ruth Roman is kind of a challenge to dance therapists, because it talks about the body in in performance as losing all aspects of identity and being a detached body, which is a challenge to our beliefs in a way. So it's a very provocative chapter. I also wanted to just say something, if I could, about the foreword of the book, which comes at the beginning by Sandra Fraley, because she is quite a wonderful writer about dance who I've always admired. And it's a superb forward, and I really am glad she was chosen to write the forward. She does say something very important. She talks about the creation of a new aesthetics, the aesthetics of care, which is exemplified in this wonderful, wonderful book. So her foreword is really, really brings that to the surface, that this whole book has to do with aesthetics, and the aesthetics that we manifest in dance therapy, the aesthetics of care. I just wanted to end with a little movement. I talked about Isadora Duncan, and some of you know that I like to do a greeting that Isadora Duncan did. I will do it as an end and as an honor to this book. A greeting Isadora Duncan did at the beginning of her classes. We can just do it. Just join me sitting down. Take a breath. I need a breath. And connect to yourself. Feel your heart and your breath. Connect to the sky and to the universe. Connect and stretch out to the horizon of the earth. Reach down and connect to the energy of the earth. Lift up and once again connect to everybody else, to connect to other people. And very importantly, connect back to yourself. And I did this movement experience in honor of this wonderful book. Thank you.
Thank you, Mimi.
Thank you.
Thank you.
Thank you very much, Mimi. That was a wonderful condensation of a lot of very important and deep material, and that you did it in such a good way is incredible. And bravo to you. Our next section will be Jennifer Tantia from New York, who edited a book on embodied research, and who will introduce the next section on research. We will again first have the titles of the chapters, and then Jennifer. Hi, Jennifer.
Hi, Sharon and everyone. I saw, okay. You're gonna do that for me, great. Chapter 6, chapter 7. Chapter 8. Chapter 9. And chapter 10. So thank you. And thank you, Sharon and Hilda, for inviting me here. It's really an honor to be able to do this and to indulge such a beautiful work. In the service of time, I prepared 20 minutes. So I'm going to describe each of the chapters, and I'm going to give just a little amuse-bouche. So Mimi, that your presentation was like so rich and delicious, and I'm going to try to just give us a little taste of each chapter so that hopefully you'll all want some more when we finish. This section on research is a special invitation written by researcher practitioners for the purpose of defining the ways in which the aesthetic, truth, and beauty can be investigated as an integral part of healing. This section advances the value of the artistic aspects of dance movement therapy through examples of the use of creativity in research. The 6 chapters in this section explicate the ways in which research interfaces with creativity, from study samples to explorations of creative processes in clinical practice, the type that elicits knowledge that could be used for a data collection method. The purpose of research is to create new knowledge, and in particular, creative research methods aim at illuminating a universal truth for what it means to be human. And each of these authors have done a brilliant job of bringing that out. So starting with chapter 5, Brauringer and Dietrich Riep offer a study that asks the age-old question, also a question that was brought to me my very first conference at the ADTA conference. What is the value of dance in dance movement therapy? So from many, many years ago until today, this question is still on the minds of everyone, and it really does seem to migrate around in the conferences. So in this chapter, the authors are seeking answers by they collected surveys from both novice and expert dance movement therapists and compared them with some of the elders' ideas about dance and dance movement therapy, the elders' thoughts on this topic. This is significant since the pioneers of dance movement therapy developed therapeutic interventions based on their knowledge of dance. That's huge. So in dance movement therapy, our theory evolved from the practice rather than a theory and then trying it out and then creating research on it. It happens a little bit differently for us. As Brauringer states, they began to use dance in a therapeutic way in order to support personal well-being and communication in others. And as Levy states, as she's noted in the chapter, the pioneers described their personal dance heritage as being crucial to the development and the practice of dance movement therapy. Over the years, folks have moved away from dance and dance movement therapy, migrating more towards movement psychotherapy. And this comes from many other reasons that I'm not going to get into too much right now. Most of you probably have some ideas of how that happened. And so these authors decided to kind of say, well, let's find out what's going on with all these, with different dance movement therapists from different levels of experience in their work. And I'm not going to tell you the answer because you have to read the chapter. So in chapter 6, Chatai and Plevin describe an artistic data collection method called TBT, which involves a cyclical process of body tracing, self-reflection, and movement. So it kind of goes in, it's not just linear in one way, but actually kind of continues in a process. And this style that was developed by Plevin, TBT, shows a way to use visual representation of an embodied creative procedure using feeling, drawing, and moving that facilitates the discovery of self-awareness. Starting at the sensory level, the investigation begins with an inner sense and develops toward the space around the body, bringing the participant into self-world awareness. On top of that, there's a self-reflective piece where you get to actually see what you've drawn based on how you felt and how you moved. And then this continues on until there's a development of new knowledge. So it can be used as a method of data collection and elicitation. The process, it can certainly be adapted for data collection and analysis in a research method. For investigating, I'm thinking of it in terms of how it could be used for different themes in future research, such as trauma, oppression, neurodiversity, or ableism. I also wonder if it might be an interesting process to use in couples work, not only self-reflection, but also seeing the other's inner awareness in shape and color. It could really bring about an increase in empathy within the dyadic therapy session. Boy, I have so many questions for all these authors. So moving on in the name of time, in chapter 7, Kalk investigates the concept of being moved from her ongoing work on the use and purpose of aesthetics in dance movement therapy. As widely known in the authentic movement practice of being moved by one's own body, Kalk explores the aesthetic qualities of beauty in relation to another. She notes that the inquiry allows a researcher to operationalize the aesthetic experience. And that's a big piece when it comes to researching something that is so felt and moved and nonverbal, to be able to put it into some kind of codification. I just read an excerpt, incidentally, recently, and I don't remember where I read it, but it was an excerpt about the differences between being touched or feeling touched by something and feeling moved by something. And the author said that she felt them separately, and that the former, being touched by an experience, was not as profound as being moved by an experience. What a wonderful support for us for our work as movers. I would love to see if there is a difference between the two, not just on a semantic level of like these two words, but also but more on an embodied level, the way this author, who I cannot remember, actually spoke about. In the chapter, there is a reference to linguistic authors who work from up here only, who say that they are the same, that being touched and being moved out, it's all the same. But I don't agree with that. I would like to know more. So from the chapter, Kalk explains how Nico Frigga, and I'm sorry if I butchered that name, refers to a category of emotions he called being moved. He argues that these ambiguous experiences are aesthetic emotions that grip the body. That's far from a passive experience and far from just saying, oh, it's all the same. So Kalk goes on to apply the concept of being moved to her 2017 model of embodied aesthetics. She writes, for dance movement therapy, research on being moved brings preliminary good news. The process of being moved by movement, being moved by your own movement or moved by another's movement, presumably connects experiencing beauty within the strengthening of self-efficacy. And boy, I would like to talk more about that and ask Sabina about that. We have, so the last section of the research section, or it's chapter 8, 9, and 10. In chapter 8, which is called Wording the Complexity of Dance Movement Therapy, a scoping review on how dance movement therapists describe their clinical practice, authors Samratar and Kantal offer a comprehensive literature review. And I also am curious if this is a meta-analysis, so please forgive me if I got it wrong, if it's one or the other. I wasn't quite sure. That begs the question, the authors ask the question, how do dance movement therapists word their professional domain, their activities, and their interventions? And this is super important because it's something that, you know, when we kind of, we're moving and we're feeling and we're doing all these things, we know what's going on, but in order to actually put it into words is so important for the development of our field and how to move us forward and how to communicate with linguists or other people in other fields who don't understand or they don't even get into their own bodies. But to be able to say it in words could be really beneficial for all of us, and for also creating a way in order to continue to study this stuff in research studies. So they note the problem of their investigation with the following conjecture. Studies often lack a clear description and integration of the dance movement therapy intervention applied. Of course, we talk about an intervention and we say we did a DMT intervention. Well, there are so many different types of DMT interventions. There's no way to really codify or to even describe, it really needs a little bit more description. And that's what these authors set out to do in this chapter, is to actually give some wording to what kind of interventions are available or possible. Their data collection in their study included information on conceptual references that were described to be relevant for dance movement therapists, information on the theoretical therapeutic orientation, information on specific structures that dance movement therapists describe for their sessions, and information on specific dance movement therapy activities applied during the sessions. Now, this, I just said a whole lot, but it's very rich content, so it's definitely worth taking some time to read and to unpack it for yourself and extract the juice that's important for you as a professional. And I also want to say of note that the authors have created a sophisticated figure that defines the continuity between meta theory and therapy model. And I think it's the circles inside circles. It's really interesting and complex. It's rich. So, in conclusion, the authors articulate some very diverse data into a systemic organized structure that can facilitate dance movement therapy clinicians' process from how they speak about their work to articulating how and perhaps even why they offer certain interventions. And that, again, is so super important when we're in teams and hospitals and when we're trying to speak to others who are more cognitively oriented. And we can say, no, I'm doing the hand jive, but there's a reason why I'm doing the hand jive. It has to do with rhythm. It has to do with shape. It has to do with connecting with another person and connecting with oneself. To be able to describe all that it really is gold. And it's something that as clinicians, as nonverbal practitioners, we often kind of gloss over. So this is an invaluable chapter, a collection of information. It's a thorough investigation of dance movement therapy practice that bookmarks where we are as a profession today, probably giving us more credit than we give ourselves. In chapter 9, Susan Imes defines 9 fundamental mechanisms of dance movement psychotherapy, ranging from safety to aesthetic mutuality. And again, I want to know more about this because when I hear aesthetic mutuality, that sounds like the highest form of fundamental safety that one can have, right? Dancing together, feeling something at the same time that we can't really describe in words. That's intimacy. Her system is a highly comprehensive system for teachers who are seeking clarification for their students regarding how we do what we do in treatment. And it also instigates further thought for the reader's professional development. So there's a lot of information, and then there are ways of asking yourself more questions moving forward. Imes writes, the AFECT, affect method, which is an acronym for 5 types of movement: aesthetic, functional/developmental, expressive, communicative, and transformative movement, described as a primary teaching method. She describes it as an active response to a set of questions regarding how dance movement therapists approach their work on a personal as well as philosophical level. The fundamental mechanisms, along with the affect method, provide a comprehensive collective of the breadth and depth of what it means to think about and to conduct dance movement therapy interventions. Excuse me 1 second, I'm gonna take a drink. And finally, in chapter 10, Purcell introduces the concept of stage theory applied to the creative process in dance movement therapy. Stage theory is a part of developmental psychology, and it looks at how stages of development evolve over the lifetime. Purcell delineates 5 stages: experience, exploration, development, insight or action, and resolution, which could be seen as a complex 3-dimensional diagram as each stage appears to connect to the other. So more like it could be even like seen as like a icosahedron, but we can't really do that on paper very well, as you all know. Soon we're going to have video to describe research, and you know, it'll be we'll be better off. So however, Purcell organizes the stages as linear for the purpose of clarity on the page, and she also defines a comparison of several theorists of the creative process, which is very interesting, and I would love to get into that today, which I can't. I don't think I've ever seen this before, that these theorists, movement theorists and others together and just organized in a way that you can really just see how different fields actually cross and connect. It's really lovely. She also defines a comparison. Oh, I already said that. And the thesis of her chapter ties the sections together beautifully as a system for explaining and possibly instructing the creative process in dance movement therapy, which is the part of the theme of the book that is just so wonderful. And all in all, these 6 chapters are rich research resources for anyone who wants a concise yet thorough overview of what it means to connect theory and practice of dance movement therapy with the potential of developing studies to further our field. So thank you for that. And are we going to have time to ask questions to the authors, or we don't know?
At the end.
We will have 20 minutes, hopefully, of question and answer section. So I believe whomever would like to pose questions could do it then. Okay. Many authors are in attendance. I'm very happy to see. Thank you.
Thank you.
Maybe we should add that the questions can be coming at the end of the next presentation, and you can write them in the chat at the end of Marianne's presentation. Hilda, Sharon?
Yeah, Hilda?
Okay, so I'm glad to introduce now Dr. Marianne Eberhard from Germany, the University of Sports in Cologne, in the Institute of Movement Therapy. And Marianne will introduce the third part, which is focused on practice. Marianne, welcome. Glad to have you with us.
Yes, thank you so much. And before we do this, I would like to ask Zeynep, could we look at each, can you stop it for just a second and give me a chance to say something? Because you see now the number of authors keeps increasing, and now we have 9 people to somehow do justice to. And I'm not going to be able to describe everyone as the other people have done because it just won't fit. So I would like to take the time to read the titles of their pieces because they already explain what they're writing about. And for people who don't know the book yet, I think this would be helpful. And then I can start into my view on these pieces. Okay, Zeynep? So if possible, I would like to read it and then we switch to the next slide.
Yes, that would be great, actually.
Okay,
so I will coordinate with you the timing.
Yes. Okay, great. Thank you. So where are we? We got them. Okay,
You can
perfect.
see it.
Yes. So first we have dancing activism, choreographing the material with and in dementia by Beatrice Allegranti. Next, seeing with the heart, the aesthetics of dance movement therapy with the elderly by Donna Newman-Bluestein. Yep, okay. Dance rhythm therapy for patients with Parkinson's disease. France Schott-Billman, Svetlana Panova, and Emilie Geoffrey Hanifi. Next. Dance movement therapy and psychosocial rehabilitation. Model Sampurnata by Shohini Chakraborty. Next. Asian Cultural Body, Dance and Therapy, a Korean Perspective by Kyung-soon Ko. Dance Movement Therapy in Japan and its Cultural Roots, Yukari Sakiyama. Dance Movement Therapy and Flamenco, Relationships Through Traditional Rhythms, and this was work with psychotic patients by Elena Cristobal Linares. Time, Space, and Aesthetics of Survival, Dance Movement Therapy and Embodied Imagination After Unimaginable Loss by David Allen Harris, working with people in Sierra Leone after the 11-year war. Thank you. And As the Dance Dies Down, Coping with Aging as a Dance Therapist, Jane Wilson Cathcart. So, thank you. So I'm very, very grateful to have this honor of being able to present something of an impression of this book, because it is such a relevant contribution to the development of the field of DMT. It has a cross-cultural perspective that could lead to intercultural development, because there's such rich information about how the different cultures experience dance and dance therapy. And then we have the focus on the art of dance and on creativity, which often get lost in everyday work in the field, in the attempt to fit in with more established bases of healthcare to justify one's place politically within that framework. And indeed, each of these practice chapters document a departure from the former path in dance therapy of relying on other psychotherapeutic schools of thought to explain what is taking place and how to structure our way of working. It's really consistent in this way, and therefore really something new in my experience. And before I get into the content, I also wanted to give you an impression of how the form can also bring something to the content of what is being said, because I found it interesting to experience how the language of some articles reflected an aspect of the message or the method or the clientele that were being discussed. And as examples, I have the tangled experience of young onset dementia captured in multi-layered and multi-syllable language, or the halting movement of the Parkinson patients revealed in accentuated brief statements, or the flow of the Sampurnata method of India, flowing from one stage to the next in a flowing narrative style, or the contained emotional state of Korean culture corresponded to by an inwardly focused, detailed case study. Now I'm going to move on to tell you about some of the overarching themes that I discovered while reading these 9 chapters. What really impressed me was the questioning of the medicalization or moralization or inculturation of experience, either of an illness or of dance or of the body. And instead, the authors departed from this and tried to show the social or the political or the spiritual perspectives. And here I give concrete examples, such as Beatrice Allegranti, I felt, showed how the primacy of bodily, emotional, and social experience is more important in working with young onset dementia than cognition as the definition of person and of quality of life. And Shohini Chakraborty explicitly explains how she chose to free dance from the patriarchal use as decoration, as objectification of women, and a celebration of norms of beauty and control, and instead use dance art practice as a challenge to the status quo, to liberate and create a subject. David Harris and Donna Newman-Bluestein both take on a more inclusive approach to what constitutes dance and healing and reframing the merger. They try to redefine dance according to population and suggest that it's a necessary skill for a dance movement therapist. And also challenging the language and history's determination of what we perceive and what we value. This moves right on into Yukari Sakiyama's view that Japan has a totally different, respectful view of the body as a source of pleasure, of contact, and of accomplishment, rather than the Western derogative view of the body as a source of sin, irrationality, or savagery that many of us Westerners have just ingrained and don't even notice anymore, and therefore cannot reflect upon. And Kyung-Soo Ko showed how the self, as inextricably linked to society, neighbors, and families, is an Asian view of identity rather than the Western emulation of individuation, self-actualization, and independence. And I find that the corona pandemic has really brought this to the forefront, how important relationships are and our place within a network of others. And many of the, if not to say all, of the contributions spoke again and again of continuously needing to let go of expectations and engaging with what is actually present. And of course, this seems self-evident, and every dance therapist would insist that she does or he does this all the time. And yet, each of these articles showed that it is a struggle that we constantly face, and we keep finding ourselves not being with the moment and trying to somehow change it to fit our expectations, and always having to let go and then reaching a totally new level together with the clients. Common relevant elements of DMT that turned up within the different articles were rhythm, for grappling with the challenges of dementia, psychosis, or trauma. Performance as witnessing and being witnessed as an amazing agent of change. Temporality, for example, in the flamenco work of Elena Cristobal Linares, in work with trauma or dementia. She worked with dementia, she worked with the psychosis, but also in the articles to trauma and dementia, we could find this importance of the temporality. And then the ephemerality of dance, how it's fleeting and disappearing, and that this has a very special quality, was also to be found. And holding and fully experiencing emotions before transforming them was also something that many spoke of as a very important thing in our fast-paced time, wanting quick results, and seeing that staying with what is and with the painful and with the different is a very important step to even reaching transformation. Dance as a source of joy was especially in the work of our French colleagues, Geoffrey Hanfi, Panova, and Schott Billman. And contact and attachment and cohesion, which can be reached through the work of dance therapy was wonderfully shown in the work with Parkinson patients and an evaluation of the work there to show evidence of this change in the group. And another aspect that repeatedly turned up was the question of the optimal degree of expression. Is dance therapy really about going all out and losing all your inhibitions? Or is it about very tiny, very sensitive, very meaningful moments, which again change our concept of what dance is in dance therapy? And the divergent element that I found in the different articles was the concept of emotions. It was very interesting because again and again I read the basic 5 emotions or the basic 7 emotions, and then totally different things were being said there. And I think it would be very exciting to see if we can find a form to agree upon, or is it important to keep these differences and the inherent consequences of their differences? And within these practice articles, there was also reference to research, but from the practical perspective, such as how hard it is to do research if you have no resources or no acceptance of yourself as a researcher by other practitioners within a healthcare setting, which is something that I have encountered many times. And also this practical section offers tools for observation, for assessment, and for evaluation. They're shared with us, and we can use them to improve our own practice. And finally, the chapter by Jane Wilson Cathcart on aging as a DMT was very salient to me at having reached the age of 62 and noticing you can't do it all the way you used to. And I found this chapter was like a written work of art, denying nothing, facing it all, and still coming up smiling and enlivened, and therefore no less than totally inspiring. So my conclusion in reading these articles was of being in awe of the engagement of these practitioners with their clients and the enormous challenges they face, the challenges faced by the clients, but also by the therapists working with them. I felt moved and touched by the stories of those that people these articles. There were touching moments of patient's experience, but also deep insights into how the therapists experience being within this process of their work. I felt proud to be part of this community, and I felt inspired to jump up from my chair and get dancing, and I welcome you all to join me and just shake out now after a lot of listening. Woo, woo, woo.
Thank you, Marianne.
Thank you so much, Marianne. That was just wonderful.
Thanks, Sharon.
What a lovely, magnificent ending. Thank you.
Thank you so much, Marianne. Now is the time for us to ask the questions to be put in the chat box, and then we will take them and see who they're directed to. So I invite you to put your questions in the chat box at this moment.
I think this has been so stimulating and inspiring. I think it's hard. And I also, even though it's been mostly verbal, there was such an embodied quality to each discussant's presentation. I want to thank you. It was very, very inspiring. So I feel like it will take a while to go to the level of words and questions, but really wanted to appreciate all the discussants.
Yes, I would also use these moments of self-organization in the audience to really to say a big thanks to Mimi, to Jennifer, to Marianne, each one in her own style, and all very thorough and very creative. Thank you very much.
So there is a question from Monica. I would like to hear the authors who are here describing what was the motivation for that for their doesn't end well.
Marcia, then she continues, motivation and inspiration for the research.
Okay. Is there an author here that would like to speak to that?
I think there are, yes, there are some authors here. Maybe they need also to.
I know that there's Donna here, and Maria Cantrell.
Iris.
I could say a few words if I, is that okay?
Who's speaking?
Sabina speaking.
Okay.
Yes.
Yes.
We had a conference in Heidelberg on embodied aesthetics, and that's where a couple of people from the Max Planck Institute of Aesthetics came, a very scholarly research institute, and they said, we've discovered this new emotion, it's called being moved. And so I started reading around it, and it was very, very interesting what came up in the field of aesthetics and in the field of social psychology. And then I thought, yeah, we use it all the time, so let's put it into a dance movement therapy framework and describe it. And it was really rich. I mean, I'm totally thrilled about the richness of this direction to just look at this one factor, because it's such a broad one. So that was my motivation to write a chapter on that.
Well, I'm very glad, Sabine, because being moved, at least in my experience, has been connected to authentic movement for many years. And so to hear it and see it being written in other contexts was refreshing. To look at being moved again in authentic movement in another way. Thank you. Yes. Is there any other author that would like to speak to their motivation?
Yes, I can say something. This is Donna Newman-Bluestein. So when asked about the role of dance in my work and aesthetics, it was something that I was grappling with myself, but never spoke to anybody about, or not very much. And I had actually done a presentation at the Dance Therapy Conference some years ago about it. But again, I hadn't brought it out into the world. And Sharon and Hilda repeatedly sort of nudged me into going deeper, and for which I'm very grateful, because as I have learned, the more deeply we go inside from Bartenieff, the more we're able to reach those outside. And so it was very useful for me to look at the lack of aesthetics as I perceived it initially in my work with people with dementia, from the food crusted on people's faces and the paper bibs that they wore, to the lack of movement. This was in my groups where there was the least amount of movement. And it was useful for me to search for where was the aesthetic, because once I found that, I felt as though I was more able to reach people and really to see the beauty, the magnificence of the work. As so many people said in so many of the different chapters, it's that authenticity that I think is exquisite in a world that prefers artifice. And I think that this is something that we, by looking at aesthetics and what we bring through the dance, that embodied way of being, this is something the world needs. So my gratitude to Sharon and Hilda for inviting me, for pushing me, and to everyone for their contributions that are so beautiful.
I can say something as well. For 20 years, I've been curious.
Introduce yourself.
Oh, sure.
Your chapter first. Thank you.
Okay. My name is Susan Imus, and I wrote chapter 9, which is called Creativity Breeds Creativity. And that's one of my beliefs and philosophies I've held since I was actually in art therapy school back in 1979. So for years, I've always been drawn to, when we work with people, what are we attracted to? And that is the basic aesthetic. What is our aesthetic sensitivity, our aesthetic preference, and our aesthetic values? And I look at all of those as part of the relationship, so that you cannot separate aesthetics from the relationship. And that's why I call now our movement relationship aesthetic mutuality. And by exploring this question to, like, colleagues, people who I've taught with, as well as students, what are you attracted to? That sets up where people go, what people ask, what interventions are happening. And I believe it's the aesthetic mutuality, along with the actual dynamic concretization of the questions and the interventions that happen through embodiment, that we call the aesthetic experience. And that's somewhat similar to what Sabina has been exploring. And that is a relationship of, it's the call and response, and the response and the call. And those go back and forth and back and forth. And that's why the word mutuality is one that I chose to articulate. So that started off the nine other mechanisms that I identified by isolating and analyzing 4 different sessions. And I came up with these 9 based on what worked in my sessions, and then was able to do some content analysis and format then the 9 that I have articulated in this chapter. But it starts with the, what are you drawn to?
Thank you. Thank you.
Can I say something?
Yes.
I'm David Allen Harris, and I started with a kind of ontological exploration. I was a choreographer before I became a dance movement therapist, and I was always trying to figure out how to set something that could last in a form that disappears as soon as you make it. And when, as a dance movement therapist, I went to Sierra Leone, I went to a country where the life expectancy was 38. And death was around me all the time. And I found in dance a way that people were able to cope with the fact that everything was escaping them. And I wanted to write about that. And that's where I started.
Hi, so this is Shohini from India. So I have written in this book in the chapter 14, Dance Movement Therapy and Psychosocial Rehabilitation, Model Sampurnata. So I first wanted to, thank all of you, like thank Sharon, thank Hilda, to invite me, to be part of this amazing book. So it's really, a gratitude. And also like, what motivates me, I think the subject, like it's so wide and it's reaching to a larger community and giving a international perspectives, and being in part of this global community is itself is a motivational factor. And definitely like in my chapter, there is like how dance movement therapy can go beyond clinical and give a, break the systemic barrier of the entire society and bring a social change. So that's experience has been narrated into that dance movement therapy and, psychosocial rehabilitation through model Sampurnata. Very briefly, including my own experience, how I came up with this entire process and then, facilitate this program. So thank you.
Thank you. Thank you.
Can I say something? I'm Yukari, and I'm the writer of chapter 16. And it is my really honor to be invited and join this project. So thank you, Sharon, and thank you, Hilda. All the process to complete my script is like a, how can I say, like a supervision with Sharon and Hilda, because it's always challenging for me to express my feeling and my ideas as a dance movement therapist. Expressing in English, it is my second language, but it's so. But try to express my idea in English is. It makes me more clear my vision about dance therapy. So it is my motivation to write and finish my script. Thank you.
Well,
Yes,
I appreciate what you say about writing in another language helps one to be clearer.
Yes, yes, sure.
English is my mother tongue, but I live in Italy. And I'm asked at times to write in Italian. And it is a challenge. It's a difficult challenge.
Sure.
But it does create other pathways to thinking about dance therapy. So thank you for bringing that up. I appreciate that. Thank you.
Thank you.
Yeah, hi, this is Rosemary Samarita. I authored a chapter on wording the complexity of our profession together with Maria Cantel. We both live in the Netherlands and work together every now and then. And I think we both have been motivated in the fact that we found that many clinicians talk wonderfully about dance movement therapy and about the processes of change that are happening there. Whereas we find, at least in the Netherlands, and I think it's also broader in Europe and also internationally, that we do not always find that mirrored in the reflection on the DMT research or in the appreciation of DMT research. So we thought and worthwhile to have a look into what do dance therapists actually say, and can we find a sort of structure there in some procedures there. And I think what really was overwhelming, that there's such a richness of wording the experiences, and it seems that there is a tendency to more and more grow a framework that really comes from dance. And I think this book is really a wonderful example of that. And I feel, personally coming from dance and working through dance in therapy and through a context of dance informing it, rather than, for example, a specific psychotherapeutic school, which I do have in my background, but in the therapy, I work through the dance experiences, and I see that so very strongly in this book, and I really am so happy with it. And also this turn towards the aesthetics, I think that is such an essential thing for us as dance therapists, to really think in terms of dance, think in terms of aesthetics. And I really feel very moved by the depth that also this the discussants brought to these chapters by reflecting on the overarching themes in there. So thank you very much.
Just very shortly, if you don't mind, I would like to continue from Rosemary, because I think it's important to say that it's work in progress to really be able to classify these different ways of describing dance therapy. And if you can, you should join us in our discussion when we are doing that in the end of April, when the Dutch dance therapists are organizing an event. So if you want to join in us in developing further the model, please join us. It's an event which is also online, and you can find out more information from the European Dance Therapy Association page and all that. So indeed, join us discussing what these structures could be and how we should call them.
Thank you. I find it so rich that the authors are talking to their motivations and what has inspired them, each one. I suppose I'd like to talk myself, and perhaps Zeynep. We are from chapter 6, and it's about the transformational body tracings that began with the training in creative movement with the co-founder Maria Elena Garcia, where the body outline has been used in art therapy and for many years. But it was how it was being used that we found fascinating by using it over time and seeing how the reflections and the embodiment would change, and that would change in terms of visually, being visualized, that would come back and feedback and change and transform the way people move. Zeynep, do you want to say a few words?
Yes, I mean, our study really came out of the practice where Marcia brought this body outline into the teaching at Istanbul Bilgi University. So this was used as a teaching tool in that context, and just seeing these body outlines, what we came to call as TBTs, kind of mature and grow over the course of teachings, and they became fuller, and there was a way in which they grew and gained more definition and expression. And at the same time, the students were really reporting a newly growing sense of embodiment. And the whole way they related to their bodies, they made sense of all the sensations, and the way they made connections just matured and transformed. So we became very interested in this question, well, how does this process work, really? That's being reported. And this chapter is really an exploration of that question from a number of different vantage points, namely mostly phenomenological. We asked the students to reflect on them, aesthetics, and really a lot of the neurological research and neuropsychology that's coming out right now is so relevant. So this is an exploration after an observation. And I also noticed Jane was raising her hand. Do you want to talk about your chapter?
Sure. It's definitely not research, but it is, because it's a research. It's a life review. And I didn't set out to do that. My undergraduate major was in philosophy, so it's great to hear Heidegger and Langer and all of that. But it was, I don't particularly love to write. This was the easiest writing I did, maybe because I didn't have to research. I had to inwardly search and try to make sense of this potchky, crazy quilt of a life that one leads as a dance therapist. So it was very, 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 very satisfying. And I thank Sharon and Hilda for the hand-holding, et cetera, and you and Marcia for doing this, for Mimi, Jennifer, and Marianne. Thank you very much.
You're welcome. I'm trying to find some other questions, but if there is another author here that would like to, Mimi, would you like to speak?
I noticed a question in the chat box. Somebody asked about what are the current challenges to our profession. Maybe we're all ignoring that, but it was there.
I was ambivalent about tackling that question, but
I'm not ready. I'm not prepared to answer it. I just thought I'd.
Oh, good.
Maybe, I mean, I don't know if anybody would like to answer that. There was another question, and maybe both of them could be handled at the same time, which said, what happens to aesthetics in this precise moment?
Yes. Yes, I'm very curious about it. I'm asking to you, Hilda, that you took care to go so deeply in it.
Hi, Federica. Hi, Inés. I think that now we need more than ever to be open to our to our sensations, to enjoy every. I think we have to be more aware, not only as therapists, as people, to to enjoy every single thing, you know, because we cannot do these wonderful trips all over the world. So, you know, to enjoy, to see the children in the street, the flowers in the garden. One thing that was a little bit mentioned is that I also talk about the positive in psychotherapy, and that I liked very much the contributions of some psychoanalysts on this point, because and psychoanalysts in different parts of the world, maybe I know especially more what happens in Argentina with this, because this is my the country where I was born, but there are psychoanalysts there, and also psychoanalysts in UK and in the United States that are criticizing. I am going back to your question. They're criticizing that in psychotherapy, especially in psychodynamic psychotherapy, there was an emphasis on digging in the pain, in the mourning, and that the idea was, as George Music, British psychoanalyst, says, there was the idea, there is still the idea in many psychoanalysts, that the more you go into the pain, so the positive or the lively aspects of your life will come up. And what George Music brings is that such a nice surname, yes, for a psychoanalyst that thinks positive. So he said that in neuroscience has showed us that the emotions, the positive emotions and the negative emotions, they go through different circuits in our brain. So it's not that if we are going to dig more into into our pain, so the positive emotions will go out. So I think that we have to be more active in our lives, and I think also when we work with our patients to leave place also to raise up these positive things that I think that aesthetics come with them.
Thank you, Hilda. I would like to, perhaps it will be an end, but I want to open this up for reflection. I believe that there is an aesthetics in the coming of our online dance therapy culture. And it is just being explored in this last year of the pandemic. It is almost, the question is, where do we find the aesthetic relationship online, and how do we relate that to the space that we sit in and live in as we connect with the client or the student? So that is, I think, a huge oncoming thinking would be, where is the dance and dance therapy online? That's another issue.
Sounds like book 3.
May I just join to that just briefly, because I think that might be, so this is Rosemary for others who are at a different slide. I think that might be also related to the question that Mimi brought up, that was also in the feed, obviously, and I didn't see it. But these are the challenges for DMTs in our times, aren't they? To work through a two-dimensional layer into depth, into three-dimensionality, into an aesthetically felt sense, or in the aesthetic mutuality for that part. But to really get that depth through a screen with the other. And there are is really some very beautiful work from the Nederlands Danstheater, so the Dutch National Dance Theater, which is a modern dance company. And they really try to bring into their live streams the view of the camera in a different way than just a registration of a performance. So the person with the camera is really witnessing what is on stage, and you can see through how the camera is put that there is witnessing going on. And I found that so inspiring, actually, also for our work, that somehow we should find ways to kinesthetically find a perspective towards the client in the screen and through the screen, so that we can get into these aesthetic relations. So I think we have a lot to do there still. So there's, at least for my part, there's really a challenge to reach through these two-dimensionality into depth and being moved and being touched, all these themes that passed by. Yeah.
Thank you. Thank you. Hilda and Sharon, do you want to say some closing remarks, because we're coming to the close before we sum up the event?
Well, I would just like to reiterate how wonderful each author has been in what they have written and what they have shared with us. And the discussants have not only brought up things that in their chapters, but brought new questions which have been fascinating. Jennifer has brought up some wonderful research questions that need now to be considered from what she has started, from what has been written already. And I thank each of you very much for being here and for sharing this wonderful experience with us. And Hilda?
I'm just very moved and touched. And I really think it has been a wonderful experience, although there were moments that even I felt personally for my chapter, I felt some moments that I what they call the the paralysis of the writer or something like this, you know, so into my own process. So, but I think also to be in contact with these wonderful authors and their thoroughness and their willingness to dance with us, because there were authors that we were asking, please can you explain this, or please ta 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 ta, and so thank you all of you for being so collaborative and so bright. Thank you.
Yeah. Bravo.
Bravi, the discussants who came. I want to thank my colleague Zainab, who is there on the screen, that we had this glimmer of an idea and said, well, yes, it needs a virtual launch.
Yeah, yeah,
we did.
Thank you.
Yeah.
So between the both reception, the receiving, and the giving tonight, it's tonight for me. I want to thank all of your presences, and it's been just a wonderful experience, and I'm sure we've received so much from everyone here.
Yes.